We just now conducting a study on drug consumption rooms in Amsterdam, and afterwards we are going to roll out this study in Europe. Other consumption rooms can join, can use our tool in order to evaluate the impact of their work on drug users.
Okay.
So I hope that in the future many consumption rooms will use our tool in order to come to comparable data.
Okay.
Well, speaking about evaluation of consumption rooms, first of all, we have to say that in Vancouver and in Sydney they had the most extensive studies on the impact of such rooms, and in the Netherlands, for example, we almost don't have. I think it's because of the missing political pressure that wasn't consumption rooms when they were established, it was not a big political issue, so there were also not such a need to prove the effectiveness of the rooms year by year. However, now we are missing data and we are really interested to measure much more better the impact of such rooms. So we have a multiple perspective in the study. We will interview the client perspective, we will interview the staff perspective, we will interview the manager perspective, and also the neighborhood perspective. There were almost no development on consumption rooms in the last 10 years. We are a particular number, 8-9 countries running consumption rooms, sometimes only one in one city. However, now we have 3 candidates who will open or had just recently opened consumption rooms, like Denmark, like in France, in Paris, and also in Brighton in the UK. They are going to open consumption rooms. That is very exciting for us, and at the same time we hope that also our evaluation tool will be used by these new consumption rooms, which make it very nice to compare them. Next year we will have a conference in Basel where we organize a consumption room meeting. We will invite all consumption rooms worldwide to again discuss the synergies, to exchange on different approaches and so on. And we would like also to reinvent the drug consumption room network, which is quite silent at the moment, and we would like to offer to facilitate the communication on this drug consumption room network. I think it is a combination of everything, of course, and no politician you cannot win elections by promoting consumption rooms or by introducing consumption rooms. But I mean, if the public situation is in such a way that there is a huge open street scene, what we had in Switzerland, and what is the case in Oslo and other cities, and you see that it's really an effective tool to reach people, then also politicians can be convinced. But you will always have an ideological opposition against this kind of facilities. Yeah. What you have to create in a local situation is, of course, commitment of different stakeholders. What was interesting to see in Amsterdam, for example, was that it was the police who promoted the introduction of consumption rooms. So here two different interests can meet each other, the law enforcement, public order aspect and the health aspect, what is very important. But at the same time you have to include the neighbors, because as we know, neighbors are not very happy. But we have research of studies in the surveys in the Netherlands demonstrating that after opening of a consumption room, the neighbors are very pleased and they support the existence of consumption room, because they see that that there's less public nuisance in the streets, and so they really realize that it has an impact also on their own life.